Hey Adele, it's Gloria, the charge nurse today.
Hi, Gloria.
Listen, I just have to give you a heads up. I am going to be like 15 minutes, maybe an hour late. I'm stuck in the Starbucks line right now. And it looks like Stephanie called out this morning and Olivia's going to be late as well. So you're on your own for about an hour, right?
Okay, well, I have not gotten a report yet, so I'm not sure how many patients there are.
Oh, I think there's a lot today. But, you know, I'll be in shortly an hour, and so will some other people, so you'll be fine. Okay, bye!
Goodbye.
Oh, hey, Adele, I'm
my
so
gosh.
glad you're here today.
Good morning.
I am so ready to go. All right, so we've had a crazy night. There's about 12 patients here this morning.
12 patients.
Yeah.
Okay.
So I'm just going to do like a quick report because I have to go pick up my kids. I'm already like 15 minutes late.
Oh, so there's no way you could possibly stay an extra hour?
Yeah, no, sorry. Okay, so 701, we have she's got pretty bad dementia. She hasn't gotten her morning insulin yet, so you might want to do that before trays roll out. 703, he had a heart attack last night. He's gonna need probably total care. 704, he has some sort of unidentified infection. Probably gonna need a couple wound changes today.
Have they started him on anything?
Yeah, I'm not really sure. So 705, she came in with digitoxicity. I'm not really sure about what her dig levels are yet.
Wow, this has been a crazy night.
Yeah, it's been crazy. And then 706, she's on diuretics, but we haven't been able to put a Foley in, so she's just gone everywhere. And then 707 has got infective endocarditis, pretty serious. And then 708's got rheumatic fever. It's just been a crazy day. Yeah, there's some more, but I'm sure another nurse will give you a report. But those were all my patients. So do you have any questions?
A lot, but if, I'll give you a call.
Oh, I'm so sorry. Bye!
Bye.
Hello, I'm Dr. Mode, and today we'll be following Adele, a nurse taking care of 12 patients by herself in the emergency room. As you may be able to see, that is way too many patients. The nurse-to-patient ratio negatively affects nurses and how they're able to give care to their patients. It can result in medication administration errors, patient safety issues, and ultimately lead to nurse burnout. Let's check in with Adele and see how she's doing.
It's just too much for one person. Miss Smith? Hello, my name's Adele. I'm going to be your morning nurse today. I just wanted to...
Where am I?
You're in the hospital, sweetie. Yeah. So we had you started on some diuretics, and we're going to need to get a Foley catheter put in you. I'm waiting on the order from the doctor, and then we will get that started. I just wanted to come in and check on you first, though, okay?
Okay.
Alrighty. Well, I'll be back shortly, okay? Please don't get up if you don't call me first, okay?
Okay.
Alright, bye-bye. Alright. Oh my gosh, I'm so busy. I have so much medication to give. Insulin for 2 separate rooms. Okay, so Mr. Jones is on his sliding scale. Okay, so he needs... Okay. This one. I'll cap this and give it to him when I see him. Alright, and this is for Mrs. Smith. She needs more than him. Okie doke. Okay, I'm in such a hurry. I have to go right now. So put these in my pocket.
As we just saw, Nurse Adele drew up 2 vials of insulin at the same time. To ensure medication administration safety with insulin, nurses need to double check their doses before administering. As you can see, Nurse Adele didn't seem to have any time to do that. She ended up throwing both the vials in her pocket at once, making it very easy to mix them up when giving them to her patients. Let's see how that worked out for her.
It's kind of weird. I feel like my insulin should have been here by now. I'm usually taking that at this time of the day.
Oh my gosh. Good morning, Mr. Rogers. My name's Adele. I'm going to be your nurse today. I'm sorry I'm late. I do have your insulin.
Bill, honey,
Mrs. Smith, what are you
I don't
doing
know
out of your
where I
room?
was. What are you doing here?
I asked you to call. I'm so sorry. Remember, I'm your nurse, Adele. I told you to call me if you needed help getting up.
I don't know where I am.
Okay, well, let me help you back to your room. Would you mind sitting right here until I get Mr. Rogers his insulin?
I'm sorry, what?
Please, I'm so sorry. We're a little short-staffed today, so I'm having to do the best I can. I don't have anyone to help. Would you mind? I'm just going to inject this in your belly.
Oh, okay.
What are you doing to him? He's my husband.
I'm just giving him his medicine to make him feel better, okay? All right. Good? Call me if you need anything. All right, Miss Smith, let's go.
Okay.
Sharps continue. Sorry about that, Mr. Rogers.
Oh, hello there. We just saw Nurse Adele make some detrimental mistakes. Because she was in such a rush, Nurse Adele forgot to put Mrs. Smith's call light within reach, and she forgot to turn on her bed alarms. Because of this, Miss Smith was able to get out of bed and disrupt another patient in his room. This led to a breach in patient safety and privacy.
Oh, I feel so dizzy. God, I'm so cold. Why am my palms are wet. Oh, something must not be right.
Miss Smith. Miss Smith, I'm sorry to wake you up. I'm still waiting on the order for your Foley to come through. I'm here to give you your morning insulin.
Okay.
So, all right, how are you feeling?
Good.
Okay. Got your insulin right here. Oh no. Oh my gosh. Mr. Rogers. Mr. Rogers. Oh my gosh. I'm calling a code. I need some help in here. Mr. Rogers? Where is everybody? Hello, Mrs. Jones?
Oh, I'm so glad you're here.
Hi, my name's Adele. I'm gonna be your nurse today. How are you feeling?
Not so good. I feel nauseous and I feel like I might throw up and I'm just not feeling too good. I think I have too much medication or something.
Okay, well, yes, that is actually probably exactly what's going on. I do have an order to stop your digoxin. Your level is at about a 3, so that's a little too high. However, I do currently have an emergency down the hall, so if you don't mind just waiting here, I'll be back very shortly to cut off your digoxin, okay? All right, bye-bye.
What? Oh, God. Oh, no. Oh, I think I'm gonna be sick. Oh, God. I gotta go to the bathroom. I know she's told me to call her first, but I can't wait. Oh, my gosh. I got halo vision. Time of death, 2:08. Oh, hey there again. We just saw how nurse-to-patient ratio can negatively affect patient safety. Nurse Adele did not have time to turn off the digoxin pump in Mrs. Jones' room after noticing signs of dig toxicity. She also delayed the patient's request to use the bathroom. As a result, the patient got up by herself and fell, hitting her head. to see you this morning. Beautiful day outside, right?
Oh, yeah, sure. It's beautiful. Did you just get here?
Yeah.
Great.
How's your morning going?
Well, honestly, not great. I mean, I have a dementia patient peeing all over the place. I had a woman just fall out of her bed. Let's see, I almost killed a man. And I have about 300 other things to do this morning, so I'm glad you're finally here.
Well, gosh, why didn't you ask for any help?
Nobody is here. I'm all by myself.
Well, I'm sorry, but you really shouldn't be taking on all this stuff if you can't practice safely.
You know, I used to love being a nurse. So it's days like this that make me wish I wasn't anymore.
Oh, please, I've heard it before. Ooh. Yeah, honey, we're gonna have to cauterize that. Oh, hey there again. As you can see, Nurse Adele is worn out. She is overworked, she doesn't have enough help, and her supervisors are not listening to her. This can lead to what we call nurse burnout. Nurse burnout happens when nurses are overworked and they don't have enough help. They lose compassion for their patients, they lose the love for their jobs, and ultimately it can end up with them quitting and leaving us with even fewer nurses to work with. We followed Adele through her entire day here at Spartanburg Regional after taking care of 12 patients all by herself. Because of the huge responsibility that is and the multiple tasks she had to take on, some mistakes were made. Let's see how Adele handles the repercussions of her actions from her rushed state.
Hi, Miss Jones. How are you feeling?
Oh, hey. I'm alright. I hit my head pretty hard back there.
You did, and I want to formally apologize. I should have told you to call me before you got out of bed, so I will take the blame for that. Do you think you may need any pain medication?
Yes, please. That'd be awesome. My head is killing me, and I mean like 10 out of 10 killing me.
Well, I will check
Maybe
your...
something strong.
Okay, well, I will check your orders and I will get back to you. I just need to see what we have available for you, okay?
Okay.
In the meantime, don't get out of bed without calling me. My button is right there.
Alright.
Okay. Good. Okay, next. Holy. Alright. What's that? Hi,
Where's
Miss
Bill?
Smith.
He usually sleeps with me.
He's not here at the moment. Is that your husband?
Could you get my apple? I usually have it for breakfast. It's in my kitchen.
Okay. Well, honey, you're not home right
Next
now.
to the pantry. It's in the pantry next to the fridge.
We're actually in the hospital. Okay.
And I usually don't sleep with this on. I have a nightgown. It's next to my bed.
Well, you're welcome to sleep in whatever you'd like. We can arrange that for you in a little bit. But for right
Thank you.
now, I want to talk to you about the doctor's orders for a Foley catheter. You are on diuretics, I can see. So we did finally get that in. So I'm going to get that started. Do you have any questions about that? It's gonna...
Just where my husband is.
Oh, okay. Well, let me see if I can get in touch with him. Was he here recently?
We sleep together every night.
All right. Well, I'll see what I can do about that, okay? In the meantime, you just relax. I'll be right back. I'm very busy right now, though, so... Also, do not get out of this bed without calling me, okay? My button is right there. All right? All right. I'll see you in a little bit.
Okay. Thank you.
Who's next? Oh, my gosh. He's going to hate me. All right. Hey, Mr. Rogers, how are you feeling?
A little bit better now.
Okay. Well, I'm really, just want to formally apologize. It was my fault that we...
So it is your fault.
It is. I made a medication administration error.
So basically you just tried to kill me.
It was not intentional, I assure you, but yes, I'm so sorry.
I need to talk to your boss. I'm gonna have your head for this. I cannot believe you did this to me.
Okay.
Where's Bill?
Oh,
Where's Bill?
who is that? Miss Smith, no!